Want to get to a topic here that is top of mind for a lot of families, health insurance and what it costs, because it is continuing to be one of the biggest challenges facing not only American employees, but also employers. These rising costs making it very difficult for small and medium-sized businesses to be able to provide comprehensive coverage for their employees. But there is a new alternative allowing employers to set aside a fixed amount of money each month for employees to purchase their own insurance plans, and that's going to give workers more choice while helping businesses out as well. So explaining how this all works is Mark Mixer. He is the CEO of Alliant Health Plans and HRA Simple. Good morning, Mark.
Good morning.
So explain to us how this works. What is this option?
So it's a new tool that's available to employers of any size. And instead of the employer deciding what's best in picking a plan that might be best for all their employees, it enables the employer to just give the employees money, and then the employees can pick the plan that best fits their needs, their budget, and their circumstances. And so instead of one or two plans that an employee might be offered through their employer's choice, now, for example, in Charlotte, there's over 100 plans that employee could choose from.
Wow, that is great. So, and it's called, the acronym is ICHRA?
Yes, it's the worst acronym ever by the federal government. It stands for Individual Coverage Health Reimbursement Arrangement. And it's an HRA it's just a version of an HRA. HRAs have been around for decades and used by employers for a long time. It's just a new version or a new twist on an HRA.
All right, so we mentioned that it costs a lot of money for small and medium-sized businesses. You said we have 100 businesses in North Carolina that do this. And what is driving, the cost, besides the cost, what else is driving folks to use this kind of insurance plan?
Great question. I think employers have found that they don't particularly care to be in the insurance business. Right? It's a complex world. There's no argument about that. And it's difficult to navigate without help or guidance. And quite frankly, businesses want to pay attention to their business, not have to learn yet another business just to be able to afford a benefit that is intended to recruit and retain talented employees. And so this gets them out of the insurance business, which is one of the primary drivers for adoption, particularly by small employers. And then, of course, cost is a dominant consideration, all right? And if you can save even 1%, 2%, or 3%, all right, that's an impact directly back to the bottom line. So that's also a driver.
From the employee's standpoint, it sounds like we have more of a choice. Any challenges facing workers that would want to go to this kind of option?
Well, the cure oftentimes becomes the curse, right? Because if I've only offered you one or two plans historically, and now you have access to 100, well, you need some help kind of navigating through how to best choose a plan that fits your medical situation or your finances. But it's really no different than buying anything else. In other words, if you bought a car, I can't go to the Maserati dealer, right? That leaves the high cost plans out. So you can narrow it down pretty quickly, and it's not as difficult. And if you think about it, over 30 million Americans in the country buy their individual plan every year. So they're figuring it out. But that's oftentimes a concern that employers have because they care about their employees. They want that to be a positive experience.
And how do employers save? How do they achieve these kinds of savings?
Well, you model it based on the difference between what their traditional coverage is versus the cost of individual coverage. But to give you an example, just to put some numbers to it, if you had 50 employees and the difference was just 3% savings, well, that's over a $16,000 savings in a year that could be used for other things that the business needs other than paying for health insurance, which is oftentimes the second highest cost for a business outside of payroll.
Exactly. Yeah. And so it says here, the report saying 9 out of 10 employees sticking with ICHRAs year over year. What does that retention rate tell us then about this kind of plan?
Well, so that's a data report, our fourth year from the HRA Council, in which I sit as the chair emeritus on that. And that data is used widely by federal legislatures, state legislators, and brokers. And what it says is that ICRAs are incredibly sticky, right? That the experience that the employees had was satisfactory enough that they stayed with that idea or that way of providing benefits. That is much higher than traditional coverage is.
All right. So for business owners who might be interested in signing up or setting up an ICRA for their employees, what do they need to think about, and what are the administrative burdens to look at?
I still think you need guidance. You need someone that is able to sit alongside you and talk about what the complexities are. You still have compliance issues. You still have funding that you have to decide. We approach that from more of a collaborative, partnered relationship. We're not attempting to make a sale. I don't think an ICRA is the silver bullet, in other words, but it might be for your organization. So I'd be happy to come alongside you and have a genuine conversation about why you're offering benefits. Your broker that you currently use might be helpful in that situation. And then I think the HRA Council as well. My website, if you'd like to get a hold of me, is benefitswithvalue.com. And I'd be happy to chat with you about what this looks like in your situation.
All right, benefitswithvalue.com. And lastly, Mark, what, as far as your position from the HRA Council, what kind of trends are you seeing then looking 3-5 years from now?
Yeah, we're still in the infancy of this. ICRA itself is only about 5 years old. We've been in it since day one and pioneers in it. We're not into hyperspeed, but now you've got as part of the House version of the Big Beautiful Bill, contained language that would have strengthened even more so the ICRA rules. So when those folks begin to take notice of this and the impact it has on small businesses, I think you're going to move into hyperspeed very quickly over the next 2 to 3 years.
All right, certainly an interesting trend we're seeing in the way of health insurance alternatives, the ICRA. Mark Mixer, thank you for joining us this morning with that great information. It's a good option.
Thanks, Jane.